Bonjour. Hello.
Good morning, ladies and gentlemen.
Thank you so much for joining us this morning for this 1 hour roundtable focused on children. I'll be very brief. We only have 1 hour for this conversation. Just a few housekeeping items. This session is recorded and live streamed. What we suggest to be doing this, we see this more as a working session than because the idea is always to get to a next step that makes us move forward. So I would really encourage all of you to, after having introduced yourself and explained in which organization you work, to be very concise and concrete. And I may intervene if I think we could get even more concrete in some of the suggestions and the way forward. But before we go into this, you've seen that the Paris Peace Forum has been working on this child priority framework, and I will turn over to Zohreen Badruddin, who is going to introduce us this concept. Thank you so much.
Wonderful. Good morning, everyone, and thank you, Bea. So my name is Zohreen Badruddin. I am a policy manager at the Paris Peace Forum in charge of our childhood initiative. So thank you all very much for being here today. We're very excited to continue a conversation that we've been having for quite a while with several of you, to introduce and to welcome a lot of new faces to this session. I'm going to do a brief introduction on what this initiative is, because there are several new faces in the room. And I will also mention that the session today, there is an issue note that we have. Members of the audience, we have printed copies, so we can have a volunteer pass this out to you so that you can follow along with some of the concrete elements of our discussion. To provide a bit of context on what we are calling the child priority framework. As we've all seen in headlines for quite a while, there have been many changes in the international development landscape. We've seen more recently, obviously, reductions in ODA and similar issues to that. But if we're speaking honestly, this is not something that's just started this year in the development community. This is something that's been going on for quite a while. And it's also manifests itself in the revisiting of national priorities, in the focus on reorienting funding towards domestic matters as opposed to international matters. And there's an overall climate we see of organizations, of countries being a little bit more risk-averse, and perhaps seeing or needing to see a more direct or more immediate return on investment in terms of development priorities. And inevitably, the most vulnerable are the ones who are short-ended by these changes. And that includes our children across the world. That's not unique to any specific geography. That's not specific or that is not unique to socioeconomic groups. Our children across the world are being left behind as this conversation and as the development sector is starting to move beyond very quickly. As you are all aware, the theme for the Paris Peace Forum this year in its 8th edition is New Coalitions for Peace, People, and the Planet. And it is in that interest that the Paris Peace Forum is trying to build a coalition of the willing, so thank you for all being a part of that, to reorient the development agenda around a central axe that absolutely everyone agrees on, whether that's governments, whether that's development agencies, civil society, households, even the private sector. And that is that our children are the most important investment we can ever make. And not only the most important investment, they're also the most unifying investment, and that's why we're all here today. And the reason to invest in our children is not just because it is the morally right thing to do. I think we all know that. I should hope that no one is going to contradict me on that in this room today. But it's also the most effective investment that we can make. And it's a subject that we can all rally our collective efforts around. And that is why the Paris Peace Forum is interested in advancing the child priority framework. We often say that children are our future. Many of us who work with children know that's a little bit derivative. Our children are our present. They're already here. And as many experts around this table and in this room can affirm, the conditions and the environment that are around a child from before they are born have a direct impact on their development, on their growth, and their opportunities throughout the rest of their lives. So investing in our children, investing in their well-being is an incredibly urgent endeavor. And to be able to back this and to be able to build this narrative and to convince people outside of this room, because unfortunately, if we had the decision-making power, I think this would be a moot point and children would have all the resources and all the research and all of the investment in the world. Alas, it is not entirely up to us. And so to build this narrative and to convince the powers that be that this is worth absolutely critical attention, we need to build an evidence-based rationale behind this, because just saying children are important is no longer enough. And to actually demonstrate the multiplier effect that is had when we invest in children from their very earliest ages, it actually eliminates a lot of the need for some of the downstream development work that we're doing. So at the risk of putting ourselves out of business, several of us in the room, this is a hugely important endeavor that we all absolutely agree with. To give a little bit of context, the Child Priority Framework was launched at the 7th edition of the Paris Peace Forum last year, where we had a panel discussion, including Director Lace, who was with us. So Director Lace, thank you for being back again and for your continued participation in this. Needless to say, the Child Priority Framework is less than 1 year old. It is, pun intended, our baby at the Paris Peace Forum. And over the past year, we've been pursuing a consultative process with many of you around the table on what does child well-being actually mean and how do we advance this agenda. We were able to do this through a panel conversation at the Financing for Development conference in Sevilla, as well as we had some meetings in New York last month. For anyone who's interested, we do have key message summary documents from those sessions. I'm very happy to share those and our concept note on the Child Priority Framework with any of you, so please do come and contact me. Moving quickly to today's session and the objectives of it, we've got two main objectives. The first is to consolidate the foundational scope of the Child Priority Framework. And the second is to have a strategic discussion on the methodology and the metrics behind building this investment case rationale in children. And the reason for that is being able to advance this narrative is based on having key indicators that we all agree with, that we are all able to contribute towards, that are not specific to certain industries, certain sectors, certain geographies of the world, to be able to place children where I would argue they belong, which is at the absolute center of the international development agenda. So to provide a bit of an outline of the Child Priority Framework for those of you who are not familiar with it and haven't had a chance to read the issue note yet, through the consultative process of speaking to many of you, and I should also mention several individuals and organizations who are not able to be with us in Paris today, we have identified 5 key pillars around the Child Priority Framework for what child well-being actually is. The first is child and maternal health. So that includes survival, immunization, access to healthcare. It includes, pillar 2 would be child education and learning. So that's early childhood education, foundational literacy and numeracy, but also cognitive development and socio-emotional development. The third is nutrition and food security, predominantly focused on reducing stunting, wasting, anemia, but of course nutrition goes beyond those elements. The fourth is physical protection, so protecting children from abuse, from or against neglect, violence, exploitation, etc. And the fifth pillar is their psychosocial well-being, which includes their socio-emotional well-being, their mental health, of course, but also children's online and digital protection, including with issues around screen time, as well as AI. We have chosen to have a priority focus at least preliminarily on the ages of 0 to 8, because we're taking the philosophy of starting early and then consolidating. Obviously, these topics are hugely important all through children's lives. That includes adolescence, and we're hoping to be able to build and scale, but we are interested in everyone's opinions on some of these elements, what this scope is, and then, of course, moving on to, okay, we're in agreement on what child well-being means. How do we measure that in a way that's actually effective, that's robust, that is comparable across countries, across geographies within countries as well, to be able to actually make this evidence case something that is relevant to people outside of this room, to be able to provide a very convincing argument. So again, thank you all for being here today. I'll let Bea do some of the housekeeping. And we're looking forward to hearing everyone's opinion. Thank you.
Thank you so much, Zohreen. And just to conclude your brilliant introduction, just a reminder that while we've been able to cut in half child mortality over the past 20 years, this is the first time this year that child mortality globally will rise again. And the progress were not just over the past 20 years, they were more about around the past 200 years. It's just the past 20 years have been an acceleration. And while the needs are widening, the resources are shrinking. So I'm really grateful to the Paris Peace Forum team and Zohreen in particular for help us guide us through this discussion. Again, you have in the issue note the 4 main questions that we hope to be able to discuss. I know the Paris Peace Forum is doing a lot of other consultation and other discussions, but obviously this group is fantastic, but we'll need more input from various regions of the world. So I'm sure Zohreen will explain to you at the end of the session how we can all follow up if interested. So I won't make volunteers for the first speech. What we thought with Zohreen is better to maybe you have a look at the 4 questions for you to be able to think through where you want to highlight some of the most important points. Because we only have 46 minutes for this conversation, and just make sure that then we will see where that leads us, and I'll be doing my best to bring this conversation forward. Thank you so much in advance for your contributions, and let's start. Shawn.
Thank you, and thank you very much for assembling us here.
Merci beaucoup et merci de nous avoir réunis ici aujourd'hui. Je m'appelle Shawn Baker à la Fondation Helen Keller International. J'allais me concentrer sur la nutrition infantile. J'ai déjà dit que je voudrais vous donner quelques chiffres. 45%, c'est-à-dire que 45% de mortalité infantile est due à la malnutrition. Et en fait, parfois, on utilise que cette adjonction du fait que ces 6 enfants avaient été bien nourris, ils seraient encore vivants aujourd'hui. Entre 75 et 80% du développement intellectuel et neuronal se produit au cours des premières années de vie, et la nutrition est essentielle pour ça. Alors, les problèmes de défaut à la naissance, de problèmes du tube neural dans l'utérus est dû à la malnutrition de la mère. Donc, à mon avis, la preuve qu'une nutrition appropriée et dont la fenêtre des 1000 premiers jours est absolument fondamentale, à ceci est ce que je voudrais défendre. Donc, j'aimerais répéter, et je dis ceci, parce que malgré ces chiffres qui le prouvent, faire comprendre aux gens et à la communauté en général qu'une nutrition appropriée est essentielle
the very foundation of child survival and development, is something, I think this is an opportunity to bring that forward. And we know what to do for them. I mean, there are lots of still questions, but there are a huge number of incredibly cost-effective interventions. And that would be my second point. While it's useful to measure nutrition outcomes, it's much more useful to measure access to nutrition services and nutritious foods, because that you can do in a very time-bound way and can drive much more action. The outcomes occur afterwards, and I think we really need to focus, if we're going to move this, on the actions that need to take place so that you can do that on a timely basis and course correct when children and mothers are being deprived of good nutrition. Thank you.
Thank you, Shawn. So I get from your intervention that you agree on the scope, the core philosophy, the measurement is possible, nutrition being at the core, one of the core elements which is in the scope. Thank you so much. Maybe Jean-Sébastien Conti, the floor is yours.
Well, thank you very much, Béatrice, and good morning to everybody. I'm Jean-Sébastien Conti, Deputy Director for Global Affairs at the Ministry for Europe and Foreign Affairs of France. So very glad to be here. My first message would be to thank the Pyro Peace Forum for organizing this roundtable on childhood and underline first that children are a strong priority for France. Education and initiatives in favor of children and youth are the most impactful investment to build sustainable and inclusive societies. And so we are very happy to be here today. At the same time, we are in a context that we all know and we all face, which is a context of global public aid decline. And in that context, we need to be, even more than before, streamlined in our initiatives and financing. So my message for today's roundtable would be a message of support to the philosophy of the action that has been taken forward, and thanks again to the Gates Foundation, the Pyro Peace Forum, and also to try to find the best value added in a context in which there are a number of initiatives. As we are preparing for the French presidency of the G7 next year, and as also the EU is preparing its next priorities for the budget cycle, we will pay a close attention to the follow-up of this initiative and the discussion today, so thank you for that. Maybe on substance, one point, I agree very much with Shawn that nutrition is a key element. The 5 pillars you have described are very relevant. Nutrition is an important element of that. And one element I like to underline is the issue of school feeding. This is why France, together with Finland, has supported the World Food Programme in launching the Global School Meals Coalition with one goal: to provide every child with one healthy and nutritious meal per day by 2030. Other elements could be underlined, but I just wanted to, not to be, for the sake of being brief, to underline this one. Thank you very much.
Thank you very much. So I hear from you that same on scope and core philosophy, you absolutely agree. The G7 may be, if this is a priority France wants to bring to its G7, may be a good opportunity to move forward on number 3 and how we streamline, as you said, on the investments. Margarita?
Thank you very much. I'm Margarita Focus-Licht, Partnerships Director at the Global Partnership for Education. And following these very good interventions on nutrition, I wanted to follow suit and emphasize the importance of education. This, as has been said, this priority framework comes at a critical time, and it's at a time when investments in children are decreasing, and at a time when the largest generation of children and youth in human history is coming of age, and most of these children live in lower and lower middle income countries. Meanwhile, the world that we're preparing children for is increasingly complex and changing rapidly. And so I just, for a moment, want us to imagine a scenario where children have access to quality healthcare, nutritious food, where they're safe or nurtured, where their community has the means and knowledge to give them the best possible conditions for growing up. And now try to imagine that without education. And I know that we can't. we need opportunities to learn for mothers and fathers, teachers and healthcare workers, both those of today and those of tomorrow. And we all know that starts with strong early childhood education. Education is a basic condition for succeeding with the aims of this framework, in addition to being one of the 5 pillars. And I just wanted to emphasize 2 points. The first, integrated early learning, that is literacy, numeracy, and socio-emotional skills, has a significant long-term impact on a child's life. It improves individual earnings, health, and well-being. And the second point, investment in girls' education yields intergenerational benefits, reducing child mortality and improving the health and education of future generations. In fact, education is the most powerful investment we can make in the future of our children and our nations and our world. It's the foundation for economic growth, for stability and resilience. It accounts for an estimated 50% of global economic growth and has helped reduce extreme poverty by 40% in the last 5 decades. So again, just emphasizing what an important foundation is, education is. GPE has just launched its 5th financing campaign to raise $5 billion for education, which will catalyze an additional $10 billion in additional co-financing for education. Our vision is for a smarter, better aligned, and system-anchored investments grounded in fiscal realities, responsible to political priorities, and designed to reinforce national leadership, which leads me to my conclusion. First of all, appreciation that education is one of the pillars of this framework, but also encouraging that we embed approaches that build stronger national systems and financing strategies in the longer term to reduce the dependence on aid. So we look forward to staying engaged from GPE side. Thank you
so much, Margarita. Maybe let me just do and I see the names up, so I will, of course, come to you. Maybe on question 1 and 2, on the scope and the core philosophy, maybe the question here should be, do you disagree with anything that's in the issue note? Maybe that will be get us to the next step, because completely agree with everything you've said. It's in the issue note. So I would be quite pointed on, again, if you look at the question, does the proposed scope, the 5 pillars, the age focus, with some exceptions, and what should they be, provide a solid, contextually relevant foundation for this work? And should this be a minimum floor, or should we aim for optimum? With the advantages, disadvantages, I would really want us to leave this room with your opinion on at least those 2 pieces, and ideally also number 3 and ideally number 4. Otherwise, I'm afraid we're just going to say we agree on all of those priorities and we'll leave the room and we'll not be able to have done that. So I really urge everyone, if you agree, that we skip and go straight to that.
Yeah, can I add just one point on this? I'm Adrien Bécassi, the policy director of the Paris Peace Forum. This is a step in a process, in coalition building effort that started earlier and that will continue. We are operating in a difficult international environment, and the core idea behind is that to drive action, we need concrete targets. We need things around which we can coalesce. It's extremely difficult because collective intelligence here is extremely helpful to then help create a framework, which is not more than a framework, but something that every priority could then be inserted in a coherent way. So I'm just
thank you so much.
Emphasizing Beatrice's points.
Thank you. Matt?
Thank you. My name is Matt Freeman, head of Stronger Foundations for Nutrition. And for the sake of responding to the challenge, I will say I disagree, respectfully, of course, with the structure. And it's in a very positive sort of way, I hope. I wanted to build on the point that Shawn was making and that others have made as well about the interconnection between some of these different dimensions. We're coming through a lens of nutrition, but I think this is probably true of some other key issues as well. It's been a great disservice, I think, over the years to the nutrition community that it's been considered separate from the maternal and child health and child survival agenda. And I do worry, even though it thrills me to see nutrition named explicitly as a pillar, that we're just reinforcing this same view that these are standalone issues and standalone opportunities. And so there's a big part of me that actually wants to challenge us to bring, in this case, nutrition, but maybe others, into those same spaces. So it's maternal and child health and nutrition. It's good nutrition for child learning and education outcomes. Maybe this is responding to Adrian's point as well. If we're looking at maybe child survival as a key outcome that we're trying to work toward, child learning as a key outcome that we're working toward, could nutrition be considered in these instances as intermediate outcomes on the path toward that, for example? So just in general, how do we find ways to integrate? And the only other point I'd make on that same theme is, can we be prioritizing more the spaces where the integration is happening? So looking at the schools, looking at the community health centers and outreach opportunities, and really focusing on those as the investments to be prioritizing jointly. Thank you.
Thank you so much. Hannah, I think you were next, and then Sir.
Thank you. Yes, I'm Hannah Stevenson with Save the Children. And I won't add to the contextualizing remarks, which are all very valid, but just to say thank you. We're sort of entering this conversation relatively late, but really, really encouraged to see what's happening and the discussions that are happening around the child priority framework. I guess the two general cautions that I have are, firstly, that we don't want to reinvent the wheel. And secondly, that everything that we do in this conversation, we want to ensure that this framework is grounded in real-world outcomes for children, which I think is what we're hearing so far in the discussion. And three quick sort of comments in terms of the challenge. So firstly, on the scope, I would say that the point we want to address here is that child poverty doesn't exist in isolation to the real world and to outside of children, and it's a continuum. So if we look at nutrition, we know that malnutrition is often an intergenerational cycle. And so there's a risk that if we only look at the age range from 0 to 8, that we're excluding adolescents and also the wider families and communities that we know are integral to achieving the better outcomes that we're seeking. So I know that we can't address everything in this framework, but I think it would be really good to see a really strong nod to or consideration to how we nod to the broader context and adolescence. Secondly, on the philosophy, I don't think that there should be a sort of pitching together of either minimum floor or an optimum. It's not one thing or the other. And the example that I would give here would be to talk about wasting and the innovations that have happened recently, over the last sort of 10 to 15 years in wasting treatment and diagnosis. We know that there's been an urgent need to scale up access to treatment of child wasting. And that has led to amazing innovations, the simplified approaches. But they are a temporary stopgap. And when we're looking at here the sort of core philosophy of whether we have a minimum floor or an optimum in terms of how we seek to support children, I guess the risk here is that, and through the example of wasting, there is a risk that actually if we continue to advocate for simplified approaches across the board, that we simplify our aspiration for children. And actually we should have a really reaching for the stars aspiration for children. In terms of how they're treated, the care that they are afforded, the rights that they have. And so simplified approaches, just as one tiny example, and they are phenomenal, and it is right now helping us to reach more children with treatment and diagnosis. But that shouldn't be the end point. That should be the how we get to the aspirational. So I use that example to illustrate that I think that it's both, and that we want to make sure that we're not inadvertently undermining our aspiration for children, if that makes sense. And then linked to that, just thirdly, it's sort of linked to the point that maybe we'll come to this later, But in terms of outcomes and outputs, again, just using that example that actually lots of the outputs, vaccination coverage, nutrition services, and how we scale and expand those are the how we get there. And so we need both. We can't have one or the other. And I definitely worry that in these really difficult times, with cuts and the seismic funding challenges that we're all facing, that we will lower our ambition for children. And so I'm here to say that I really hope that we don't do that through this priority framework, and that we can continue to sort of seek the how, the outputs, as well as the reaching for the stars outcomes. Thank you.
Thank you very much, Hannah. I think Mike, and I apologize if I'm not completely following the actual order of... Yes, Mike, please.
Hello, and thank you for the invitation to be here. My name's Mike Wishart from World Vision International. We're a child-focused agency. I'm agreeing with a lot of what I've heard so far. We would really like to see an integrated approach across these pillars. We've been doing research with Oxford University on this in 7 countries, and see a real opportunity to identify development accelerators. And in particular, in order to reach the most vulnerable children, the evidence is showing us that we should be integrating social protection programs as well, where the income support really gets to the most vulnerable children. So we would like to see those, we strongly support the 5 pillars, but would like to see an integrated approach across them. In terms of the age range, we too would like to see a broadening to include adolescents. We know that several issues, many issues across the 5 pillars really peak during adolescence, and we're concerned that if we focus entirely on the 0 to 8 age range, we will lose those gains as we move through adolescence. Just taking a kind of step back and thinking about coalitions, including adolescents, also we think really boosts the coalition around this framework that we're talking about. Children and, of course, adolescents are change agents themselves. They're champions, they're political actors. They will soon vote if they aren't already. And they should be a part of this coalition and can drive change. And maybe just to give a solid example of that, we, with our partners, have mobilized thousands of children to provide their perspectives into the Nutrition for Growth Summit that was held here just a few months ago through the Nutrition Dialogues programme. Voices of children from the most marginalised communities around the world. And it culminated in a call to action that was presented by 2 adolescents in the official closing ceremony here in Paris. So we feel that broadening the age range is the right thing to do for technical kind of reasons, but also the right thing to do in terms of a coalition that's really going to drive change. We know the best possible framework won't drive change on its own. It's going to take a strong narrative and a strong coalition behind it. Thank you very much.
Thank you so much. So a few things. Number one, on the integration, do you mean, Matt, of maybe the point... No, Mike, the point Matt was making on where integration happens, just going back to your own remarks. The second is on the call to action from adolescents and Nutrition for Growth. I would ask our government representatives here if this had an effective... It should happen, but did they have the impact for the help for the funding that we hope it would? Is that decisive in the final decision that brings support, in addition to being decisive in the fact that you need to have one? And then as I go to the next speaker, I would ask for you to be short to 2 minutes. We have 25 minutes, and I really hope we can listen to everyone. So the next one on the list, I think, was...
Thank you very much. Good morning, everyone. My name is Gulnora Mohammadi. I'm from Aga Khan Foundation, a global lead for gender equality. Huge thanks to Paris Peace Forum for this important conversation, and for us at Aga Khan Foundation, early childhood development and their well-being is a huge priority. For over 6 decades, Aga Khan Foundation and AKDN Group have been investing, and the late His Highness Aga Khan IV also always emphasized the importance of investing in children's well-being. Wearing my gender lead hat, I think we have to strengthen a little bit the gender lens around the scope, because walking across 12 countries in the most remote areas of South Asia, Central Asia, Middle East, East Africa, I do see that there is a lot of structural barriers for women during pregnancy to reach the services, in addition to all the limited services available in the most remote areas, there is also lots of social norms and structural barriers. I really would like to see more kind of pronounced approaches when it comes to this. I fully agree in terms of integration. I think it really helps when we don't speak on different sectors in silos, because in most of the countries where we work, the funding is limited. So therefore, the ministries, they don't have a luxury of having separate conversation around nutrition, health, education, ECD. So it's really important to bring all the players together, and of course to bring the civil society voices, because community-led interventions, making sure that the community health workers are engaged, making sure that the families are supportive of these ideas, it's really important. And I think we have also at some point in the issue paper to emphasize the care infrastructure, because what we see across our countries, we started now in Kyrgyz Republic, where we are training social entrepreneurs to set up community-based early childhood centers. It's a very small centers very close to the rural communities, and there is a really great excitement and support from the families, and again, it kind of brings lots of positive impact around job creation for women, making sure that the children who otherwise don't have access to these services to travel to larger cities, the services are more affordable. And my final point is around the financing instruments. I think this year showed that unfortunately lots of reforms and lots of exciting initiatives that we can implement may not be sustained. Maybe we need to come up with some initiatives around how can we strengthen the local financing architecture. So how can we make sure Ministry of Finance does stronger child-focused budgeting? How can we make sure that Ministry of Health, Nutrition, Education, they all work together, so that they don't drive their separate agendas in silo? Otherwise, happy to contribute when we kind of have the next draft of the paper. Thank you.
Thank you so much. Love the child-focused budgeting idea. Anton, do you want to say a few words? And Valerie? And
yes. Sorry, I'm the head of the Spanish Development Agency, so I'm no expert on children, except probably my own, and I'm not even sure. Just 4 quick points, 2 on the narrative that I think very important. First of all, framing this as an investment is the key message in this moment. We are saying it, less aid, not because of countries like mine, but yes, there are cuts, and we need to be much more razor-thin focus on what it is that makes the biggest bang for the buck. And certainly there is a case to be made that investing in children is good, not just for the children, for children today that will be adults later on, but for the whole of society and development outcomes more generally. Also, this idea of investment underlines, and I think someone has mentioned it, national systems. Less dependence on aid, but actually building the system so these children have access to services and develop their own lives relying on country systems. I would add the element of rights. I think let's be careful not to have children as vulnerable people or people that need aid or help. They are the subject of rights. They shouldn't be the recipient of aid. They should be agents of change. And I think this is important. If you look at our own strategy, our children focus is through human rights, the rights of children. So we're talking education, we're talking health. These are rights. It's not give outs, not gifts that we give to our children. And then 3 concrete points on the methodology, little points of disagreement maybe. Number one, I don't think children should be a sector, and I think there are many sectors represented here. We need to have a children lens in education, in health, in climate, and a number of things. So I think that's one point. Second, the paper is a lot about development. That's great. Let's don't forget children in emergencies, children in humanitarian contexts. We are seeing children's rights. Well, unfortunately, humanitarian contexts are becoming very pervasive, and we are seeing things and children being left out, including, in the ongoing discussions about humanitarian reset and humanitarian principles. Let's don't forget access to education, for instance. That is an important one. And last point, I also agree with those that say going only up until 8 may be a bit problematic. And I'm saying this from the perspective that the colleague from Aga Khan has said. Girls. We are seeing a lot of inequalities and the gaps, for instance, education, and please everyone, countries around the table, pledge to the Global Partnership for Education Replenishment that is happening now. We see a problem with girls, particularly at those ages. So if you leave pre-adolescent, adolescent girls, we are going to see issues related to education dropout rates and things like vaccination, things that we are doing, for instance, with Gates and others around HPV vaccination, prevention of cervical cancer. So I understand we need to be focused, but at the same time, leaving pre-adolescent and adolescent kids, in particular girls, would be missing out certain things that start early on, but maybe manifest themselves or actually get aggravated in this particular crucial point in everybody's age.
Thank you so much, Anton. Valérie?
Thank you. I'm Valerie Bimo. I lead the emergency response for the Gates Foundation. I think I wanted to come back to the things about access to services, but the environment in where the child lives. I think for me, that is a critical piece that I don't see in the scope. Because with all what we're talking about, access or environment can be, is the child living in a crisis or humanitarian setting. We know that this will be impact the life forever. It's the climate change, which environment where the children is living, the climate will deter how it is. We know the heat wave will deter the health of the mothers and will create already anemia and issues with the child to be born. We know that access to school will be critical, and I agree with the adolescents, because I think in a lot of the places where we see problem with education, we see problem with health, is the adolescents who are prematurely pregnant. That means that it will be anemia. That means that the child will be deficient, and they're in the environment. I think for me, the environment in which a child, and that is coming back again to how do we do a cross-cutting, or how do we do maybe a combine. I like the child approach, the child in mind with the child well-being. One other thing that is really important is how do we think about the community themselves. I think we are focused so much about sick child. We are not thinking about the health child. Child being, and that means that is the whole environment, and we tend to focus on household. I'm coming from a community in Africa where it's about the community. And if the community is not healthy, if you don't have everybody coalition, like we said, a child is raised by the community. But I see here we are so focused on the individual instead of focus on how we ensure that the whole community is thriving. That means that economic, that means that access, infrastructure, policy, political, well-being will be essential for us to be able to move the movement further. Thank you.
Thank you, Valérie.
Good morning, Mehrdad Hassani from the Rockefeller Foundation. I would like to lend our voice to expanding the scope to include adolescents. We have seen the conversation move forward towards the first 8,000 days rather than the first 1,000 days. So to put a limit at an arbitrary age of, say, 8 or 5 or whatever would seem to be counterproductive, even a step backwards. We would advocate the consideration of school meals, and there is an SDG4 indicator, official indicator, which is the proportion of children in each country that receive school meals. Why do we recommend this? Just look at what governments themselves have prioritized. 112 governments have joined the School Meals Coalition. There's a doubling of the investment in school meals from 2020 till now. It's now at, I think, $88 billion a year. 99% of this comes from national budgets themselves. So in a world where ODA is disappearing, surely we need to prioritize where that financing is going to come from, and it looks like it'll be national governments.
Thank you so much, Monsieur.
Xavier Hospital, team leader in charge of school health research and evaluation in the section of health and education. I think I agree with the framework, the philosophy, with the two slight concerns, one of which has been raised already, which is about the age group. I was thinking in particular about early adolescence from 10 to 14, where children go through very critical changes, not only puberty, but physical, psychological, social changes that go very fast, and that may be only second to the changes that go through to a child from 0 to 3 years old. And I remember an excellent program from Save the Children focusing on early adolescence. The second concern is about the focus on physical protection, which of course is absolutely essential. I would like to make sure that other forms of violence to which children are subjected are not forgotten, such as psychological and sexual. And particularly when talking about the importance of education, nobody has disagreed with that so far. The importance of providing enabling learning environments free of all forms of violence, physical and also psychological and sexual, speaking about bullying and harassment. And there is a strong case to make in terms of return on the investment. For $1 invested in preventing violence in school setting, the return can be up to $87. And I think it would be good to make sure that the contribution to the child well-being goes also through the protection from violence to the child's well-being, psychological and social as well. Thank you.
Thank you. Mr. Rimal.
Thank you, Paris Peace Forum and Gates Foundation. So my context will be from Nepal. So I represent Karma Yoga Foundation from Nepal. And it's great to hear about all the global perspective, but I have few things that I would like to talk regarding the right from the ground. So we are working on a very small project in Nepal. It's been 5 years our foundation has established, and we've been working in education and child well-being. That has been our main priority. And after working in this area for almost 3 years, we realized we've been investing so much in education, but have we realized, have the children been attentive in the school? Do they go to the school? That's a question mark. So we came up with the idea to build a playground in a community school. Using the waste materials, we wanted to upcycle them. And not only that, all we wanted to do was we wanted to bring in kids and also engage them by painting, involving them so that they take kind of ownership. So children, if from a very early age to the growing phase, if they are not able to play, they will not able to explore them. So we wanted them to explore it by themselves. We wanted them to connect with the school and the books through play. So right now we're doing a small project, and through this, 90% of the attendance has been improved in some schools, and we have done it already in 50 schools in Nepal. So yeah, I think we have it here regarding play, but there very less. No one was more concerned about it, and I think investment in kids through play is really important. And yeah, thank you.
Thank you very much, Monsieur Barmel.
Thank you very much, and thank you very much for the Peace Forum for prioritizing children and their rights as part of your discussions. And I understand also that France is intending now to prioritize it under its presidency for the G7. So that's great news for all of us and for children. Maybe to answer specifically your questions, the first one on the philosophy, I think we need both. We need both to accelerate interventions to ensure that there is a core minimum for children to have, but at the same time continue to be driving by the principles of the Convention on the Rights of the Child, which are, being aspirational goals, but these are very important. And let's remember this is one of the convention, which possibly the most ratified convention in the world by the member states. And that requires for us also to approach childhood from a holistic approach, which is exactly also what you're intending to do. On the maybe on the scope, more or less they actually mirror the outcome areas of the strategic plan of UNICEF, but I would support very much the integration of different pillars as part of one under the child survival and development, putting health, nutrition, but also water and sanitation intervention, which are missing as part of the pillars mentioned. I would possibly add one more on child poverty. Child poverty is multidimensional. It goes beyond the deprivation under the pillars mentioned, and that, as we know, has a key impact for children in their current well-being, but also in the future. I would like also, as part of the scope, to underline maybe key principles, one on integration, which was mentioned earlier by a few colleagues. Second one is equity. We have not spoken so much about inclusion, equity, the most vulnerable ones. The risk of just focusing on global indicators is that we miss those who are really left behind. And when we design interventions, we should have inclusion and equity in mind. Some principles are key for these scopes to be implemented. Child participation, as was mentioned, is key. Gender dimension, which are a bit overlooked as part of the framework. The need also to incorporate the environment dimensions. Our interventions should be climate resilient, whether we work on health, education, or WASH. And finally, the humanitarian part. Humanitarian diplomacy is key to protect children from violence and getting them access. So that's a bit on the scope. On the target groups, supporting very much to adopt a life cycle approach with set of interventions which are different, whether you're 0-3, 3-6, 6-8, 8-12, and then the adolescents, very important. And as part of that, also we need to give a specific attention to adolescent girls for their own right, but also because they are an accelerator in our development for our development goals. Indicators, and I will conclude here. I think we need both outcome level type of indicators to also help us to think whether we are on the right track with the different interventions that we put in place, and the output ones to monitor progress along the interventions that we agree on, and they are especially important when we develop innovative and new interventions. This is the output indicators are absolutely key. But thank you very much.
Thank you so much. That was a fantastic first round. Someone earlier at the Gates Foundation was telling me, never fall in love with the structure of a framework, it will break your heart. And I think maybe the next question will be, I'll turn over to you, Zohreen and Adrien. Maybe the next round of discussion, we should ask what we should take out And now that we have very well-pointed remarks on what else to integrate, the indicators and output discussion should be, and outcomes should be very interesting one.
Perhaps a 3 point at this stage, so not trying to summarize, but obviously there's the on the scope, the pillars, maybe it was not the right words, pillars, are not separate. They're something together, which is investment. Investment in the human capital of the future, investment, that's what children are at the end of the day. Second thing that we need to, we'll take out and continue to work on, is this articulation between outcome, intermediate outcomes. Maybe it's not either or, it's probably a bit more complicated than that, probably linked to age groups. Some things should be attached to one specific group, other not. Something could be real outcome, other process, early adolescent, especially for girl came several times, so we'll integrate that. Third thing, an articulation between international and domestic action and financing. The framework should be less dependent on aid, or else it would not fly in the next 10 years. So here that would need to integrate some of the national priorities as well. A general comment, the natural tendencies in that kind of process will be to put everything, and we all want to put everything in it. I think, and that will be your hard work in the next months, is really try to identify. It's not a question of priority really. It's the indicator of the targets that are workable and actionable, that needs others to be achieved. Without being too vague, we can say ending poverty, that's a job for the World Bank, ending poverty, and it's so multidimensional that if we put that indicator, then it will probably not be enough to really drive action. So there will be a lot of future discussion to come on finding the indicator that could be sufficient to mobilize, and that could be enough to coalesce around some form of collective efforts that we know would in turn drive other aspects of the same question.
Thank you so much. We have 3 minutes, but any final sort of thoughts, remarks, really fast, obviously? Oui.
About output indicators, we shouldn't wait for 5 years to understand if we are going in the right direction. This is why both are very important.
Shawn?
Thanks, Béatrice. I just wanted to come back to what you said at the opening, which I think, I've worked in global development for 40 years. I'm sure many around the table, and we're looking this year or next for the first time in my lifetime, more children are going to die than the year precedent. And it's incredibly uncomfortable. I just think we're in a case, be it partner governments, donors, that we're faced with radical triage of how do we best use resources to do the absolute most necessary things. And it's uncomfortable because we've all struggled for so much of our lives to build things we believe deeply in, that have deep evidence bases. And how do we come together? And that's why I appreciate this initiative. If safeguarding children's lives and future is absolutely core, how do we really come together? So I think there's an urgency for a clarion call of things we can agree on. And there may be things we disagree on the margins, but let's at least come together at an absolute core that's non-negotiable. Thank you.
Yeah, the triage is telling.
Thank you very much. Maybe along the lines about the key issue of prioritization, I think it would be good if the framework maybe focuses on where the problems really are, and especially in the fragile context and fragile countries, because this is where the indicators are very much lagging behind. And it's a way also to mobilize different actors. Also in this area, it's going to be very difficult to mobilize the private sector. So I think this is where the whole aspect of the public financing, domestic but also international, of course, the grant is going to make a difference. So maybe the focus is more on where, than the what. Thank you.
Very quickly on the how, it's one thing for all of us to come together at the global level and talk about the integration. It's another thing to make it happen at country level, and that needs to be done by supporting local stakeholders to come together and make national plans that cross sectors. And we've seen that in some of the work that we're cross-sectoral work that we're doing, just actually getting down to the concrete actions needed, bringing stakeholders from different sectors, civil society, government, to really create owned national plans, because as we know, circumstances differ across the contexts that we work in.
Absolutely, in the method, Valérie, and then we will.
Yes, I think I wanted to come back to the initial piece. The first responsibility of the children is their countries and their government, and I think we need to put pressures to government, not seen as a development and aid, but each government should take their responsibility and having serious programming at national level for the child and integrated way. Thank you. Just quickly to echo Margarita's point on coordination. We are GPE coordinator in Kyrgyzstan, and we see to what extent the government is heavily involved and they feel the ownership of the process. I think it's really crucial to look at those countries where we have good examples. On the adolescent, I really agree with colleagues who mentioned that we have to look at it separately, because at Aga Khan Foundation also we have adolescent pathway program that we piloted in a number of countries, and it's showing that to what extent this group really lacks the services, the support, and the infrastructure that they need. Thank you.
We are already over time, but I would love to continue. So I don't know if anyone is having a coffee after, but we could continue this conversation, including whether, based on what was just said, whether that should be like we've done country platforms in other areas, where that should be the way of moving forward for some of those priorities. Thank you again so much, Zohreen, Adrien, everyone, for coming around the table and for all of your participation. Zohreen, do you want to say last few words?
Yes, just to wrap up, because I know we are over time. Thank you again for everyone being here. Obviously, 1 hour is not enough time to solve this problem, but I do appreciate the 1 hour that all of you have put into this. I will reiterate, this is an ongoing consultative process. Those of you who've not had a chance to say, unfortunately, we didn't have time for audience participation, but please do share your contact details or come get my contact details. We've, as I mentioned, have concept notes and summaries of our previous sessions. And I would be remiss if I don't mention that at 2:15, we are going to have a panel discussion. It'll be on Senbe, on stage B, that is on making the case for putting children first. And of course, we will have Monsieur Vanvel, we will have Valérie as two of our multiple distinguished panelists on that session. So please do come and join us from 2:15 to 3 o'clock as well to continue the conversation, and certainly after the forum as well. Thank you all for your time.